Newborns can't see. Actually, they can. Babies are naturally drawn to faces. In fact, they show a preference for looking at pictures with two triangles and a circle arranged like eyes and a mouth, rather than the same shapes in a random pattern. This myth may have arisen because newborns can only focus on objects up close, with distant objects appearing blurry. Newborns can't hear. Babies begin hearing sounds while still in the womb, a few months before birth. A mother's voice is especially clear to the baby, but the father's voice can also be heard through the mother's belly. Babies don't remember anything before birth. While it's uncertain what or how much babies remember, we know that if you repeatedly read the same nursery rhyme during the last months of pregnancy, your newborn will recognize it and distinguish it from unfamiliar rhymes. A baby's first smiles are just reactions to gas. That's amusing but not entirely accurate. Babies are born with reflexes that cause them to mimic the expressions they see. When you smile, your baby reflexively mirrors that smile, even without understanding the reason behind it. Soon they learn the meaning of smiling and begin to do it intentionally. When a newborn suddenly flails and jerks both his arms and his legs, he's having a seizure. Usually this isn't the case. These movements are startle reflexes, which occur when a baby is suddenly disturbed, such as by a loud noise. Startles can happen without any obvious cause, and while they might seem concerning, they help the baby learn to soothe themselves. The startle reflex often leads to a series of actions that result in the baby comforting themselves by sucking on their hand or fingers. Too much holding and handling will spoil your baby. Showing lots of affection will not spoil your baby. In fact, it strengthens the bond between you and enhances their sense of security. It's important to find a balance between your baby's need for closeness and the other responsibilities of caregiving. As your baby shows signs of readiness, you can gradually encourage them to learn to calm and entertain themselves. Infants need to be bathed every day. While it's fine to bathe your baby daily if they enjoy it, it's not necessary for young babies. They only need to have their face, neck, hands, and diaper area kept clean. Daily baths can actually dry out a baby's delicate skin. A gentle sponge bath is usually sufficient on days when a full bath isn't needed. Picking up a crying baby will spoil them. You cannot spoil a young baby by picking them up when they cry. Crying is one of the primary ways babies communicate their needs, whether they are hungry, uncomfortable, or in need of comfort. Responding to their cries helps build trust and security. Observing and understanding your baby's cues can significantly aid in meeting their needs effectively. Teething causes fever. Although many parents believe teething causes fever, this is not true. Teething usually starts between 6 and 24 months, coinciding with a period when babies are more susceptible to infections. A fever should never be attributed to teething alone, as this could lead to missing an underlying illness that requires medical attention. If you're unsure, consult your doctor. Putting honey on a dummy will help with teething. Honey should not be given to children under 12 months due to the risk of botulism. Additionally, dummies coated in food or drink can pose health risks. Many babies do not experience significant discomfort from teething, so additional remedies may not be necessary. Avoid using alcohol and sweet substances, as they are harmful to babies. Baby walkers will help them walk sooner. There is no evidence to suggest that baby walkers help babies walk sooner. In fact, walkers can delay muscle development and may make it harder for babies to learn to walk. Walkers also pose safety risks, as they can lead to accidents. You need to clean the baby's cord with antiseptic and alcohol. It's unnecessary to use antiseptic or alcohol to clean your baby's umbilical cord stump. Cleaning it with water as part of your baby's regular wash or bath and gently drying it is sufficient. If the stump gets soiled, a mild soap can be used. Babies need to poo every day. It's normal for babies to not poo every day. Some babies may go several days or even up to a week without a bowel movement. As long as the stool is soft, they are not constipated. Fully breastfed babies are particularly unlikely to become constipated. Babies who hit developmental milestones early are gifted. Each baby develops at their own pace, and reaching milestones early does not necessarily indicate that a child is gifted or special. Developmental milestones are just general guidelines, and each baby will progress in their own unique way. Babies need to be in a routine from day one. It's unrealistic to expect a newborn to follow a strict routine. Newborn sleep patterns are different from adults, and they typically sleep for only a few hours at a time. Many babies also go through phases of frequent feeding over short periods. Establishing a routine takes time and should be guided by the baby's natural patterns. Babies are always delightful. The reality of parenting includes dealing with a lot of crying, vomiting, and dirty diapers. While babies bring joy, caring for them can be challenging, especially in the early days. It's important to be prepared for the less glamorous aspects of parenthood. Babies sleep through the night from birth. Most newborns do not sleep through the night. Their sleep cycles are shorter than those of adults, and they wake frequently to feed. It is normal for babies to wake every few hours for the first few months. Establishing longer sleep patterns takes time and varies from baby to baby. Swaddling is harmful for babies. When done correctly, swaddling can be very beneficial for newborns. It can help them feel secure and improve sleep by preventing the startle reflex from waking them. However, it's important to ensure that swaddling is done safely, with the baby's hips and legs free to move. To avoid hip dysplasia, babies need solid food right away. Babies do not need solid foods until they are about 6 months old. Before this age, breast milk or formula provides all the necessary nutrients. Introducing solids too early can increase the risk of allergies and other health issues. Babies should always be kept in complete silence. Babies can actually sleep better with some background noise. Complete silence isn't necessary, and sometimes a low level of noise, like white noise, can be soothing and help them sleep. Babies are used to the sounds they heard in the womb, so a quiet environment isn't always essential. Babies should always be dressed warmly, even indoors. Overdressing a baby can lead to overheating, which can be dangerous. It's important to dress babies in comfortable, breathable clothing and to adjust their layers based on the room temperature. A good rule of thumb is to dress them in one more layer than you are comfortable in. All babies develop teeth at the same age. The age at which babies start teething can vary widely. Some babies may begin teething as early as 3 months, while others might not get their first tooth until after their first birthday. Both scenarios are completely normal, and the timing of teething does not indicate any issues with a baby's development. Babies should be given water regularly. Newborns and infants typically do not need additional water. Breast milk or formula provides all the hydration they need. Giving a baby water before they are 6 months old can interfere with their ability to absorb the nutrients in breast milk or formula and can potentially lead to water intoxication. Exposing babies to cold weather can make them sick. Contrary to popular belief, simply being exposed to cold weather does not directly cause illness in babies. Illnesses such as colds and flu are caused by viruses or bacteria, not by exposure to cold air alone. However, it's still essential to dress babies appropriately for the weather to prevent discomfort and potential issues like hypothermia. Ensuring they are properly dressed in layers, including a hat and mittens during colder temperatures, helps regulate their body temperature. Babies need shoes as soon as they start walking. When babies are learning to walk, it's actually more beneficial for them to go barefoot or wear soft, flexible shoes that allow their feet to develop naturally. Barefoot walking strengthens the muscles in their feet and ankles, improves balance and coordination, and enhances sensory development. Shoes with rigid soles can hinder these processes and may even increase the risk of tripping and falling. Soft-soled shoes, like those made of leather or cloth, offer protection while still allowing for natural foot movement. Babies should be woken up for feedings during the night. While it's crucial for newborns to feed frequently, especially in the early weeks of life, waking a sleeping baby for feedings during the night isn't always necessary. Most newborns will wake up on their own when they're hungry, as their tiny stomachs need frequent refueling. Forcing a baby to wake up when they're not hungry could disrupt their natural sleep patterns and make it harder for them to learn to self-regulate their feeding and sleep cycles. Babies who are small at birth will always be small. While birth weight can be an indicator of future growth, it doesn't necessarily dictate a baby's size throughout life. Many factors influence a child's growth and development, including genetics, nutrition, and overall health. Some babies born small may catch up in size and development over time, while others may remain smaller than average. Regular checkups with a pediatrician can help monitor a baby's growth and ensure they are developing appropriately.